Hello everybody, and we are back at discussing the digestive remedies of Dr. Nash. Antim Crud is one of those remedies. We have already discussed the other three, which were pulsatilla, nux vomica, and bryonia. And right now we will be discussing this beautiful remedy, Antim Crud. And the topics that Dr. Nash talks about under this remedy will be GIT, obviously, because it's the group of digestive remedies, mind of Antim Crud, constitution, and some of its important modalities. So let's start with GIT, which is very important in Antim Crud. So the very characteristic symptom in GIT, which Dr. Nash calls as the leading characteristic, is this. It's the thickly coated white, very white as milk tongue. So this is how Dr. Nash writes it. It's white, it's very white, it's white as milk. The causative modality in Antim Crud is overeating. So whenever they have any stomach related issues, the cause most of the times has to be overeating. They will eat a lot and they'll like they'll be like this motu potu person, so they'll eat a lot, and this characteristic tongue will always be present. So if a patient comes to you with any stomach related symptoms and tells you that I had a lot of food and a lot of junk food, maybe whatever, a lot of overeating has been done, characteristic tongue is has to be there, and mostly you will find it in babies. Many baby patients who have these stomach related issues and have this white thick coated white tongue, you can think of Antim Crud. Okay, now here the gastric derangement is of a recent date. It is not like the food poisoning or anything happened a lot of weeks ago and still there is pain. Okay, but it's of a recent date, like it's happened recently. Some ailments from has happened recently, and the process of digestion is hardly underway. What happens in Antim Crud is that the food, like it hasn't even been digested. Okay, and before that only they'll start having the symptoms. So the irritation taste of the food as he ate it, so just the same taste that he felt when he was eating the food will be there in the irritations of the patient as well. The sufferer feels as if he must throw up, so he must vomit before there will be any relief. He feels that if he vomits, okay, he will feel better. He will feel that it's he will get some relief. That is what the sufferer will feel. So that is a few points about the GIT related symptoms. There are only a few very important things that we have to remember, and it's very easy to remember. The first thing is that this thickly coated white tongue. Okay, when you see this tongue, you have to have Antim Crud as a differential remedy in your mind. Okay, thickly coated white. So even Bionia has thick white coating over the tongue. Pulsatilla can also have white coating over the tongue, but Antim Crud is like, it's like very characteristic in Antim Crud, and it's very thickly coated. Okay, ailments from overeating is there, and digestion is hardly underway. It's okay, it has just started maybe, or it is not even started, and before that only they'll have those symptoms. All right, so this is about GIT. Only one more symptom about GIT is there, which is related to piles, which we will study. So about the piles, there is continuous oozing of mucus staining the linen, very disagreeable to the patient. So the piles are such that there is continuously the mucus is oozing out of the piles, out of the hemorrhoids. It is so much that the linen is getting stained because of it. All right, so we have already studied about the ailments from of the stomach related symptoms. Now there is also diarrhea in this remedy. Okay, this diarrhea is due to again dietetic errors or and heat of summer. Okay, always in Antim Crud, heat of summer aggravates them. Okay, heat of summer will aggravate them. It is a aggravating factor only for them. Summer, sun, heat, it all aggravates them. So heat of the summer in general also aggravates them, and then their diarrhea will also get aggravated. Stools will be partly solid and partly fluid. So the stools texture will be like this. The diarrhea will alternate with constipation, often found in old people. Okay, so it's often found in old people. When you have patient who is old and who also complains of diarrhea alternation with constipation, and also you should have the characteristic tongue, you can always think of Antim Crud as a remedy for it. Okay, this was about the GIT. Now we go to the mind. So in the mind, the patient says that he is in great sadness. Okay, the patient will be in great sadness. He will be in a woeful low mood. Okay, especially with intermittent fever is what Dr. Nash says. Okay, and then there is sentimental mood in moonlight, ecstatic love. So sentimental mood in moonlight, ecstatic love is there. So it's like in moonlight they'll feel all this romantic and all. So that's how it's said. The child cannot bear to be touched or looked at. So this is a very important symptom in Antim Crud. The child cannot just bear to be touched or looked at. So whenever the doctor tries to touch the patient's abdomen, if he's come for any digestion related issues, stomach related symptoms, so you'll try to palpate, right? But the patient or the child would not want you to touch him, okay, would not want you to auscultate him. He even does not want you to look at him, even does not want you to observe him. So he cannot even bear that. Okay, that is a very important symptom in this remedy. Also, the sentimental mood in moonlight is also very important. Dr. Allen in his keynotes also explains this symptom, also writes about this, so it's very important. The child is cross but not like chamomilla. So now the child is cross, but see that he is not as cross as chamomilla me. He wants to be carried and soothed, but will scream and cry and show temper at every little attention. So they want to be carried, okay, they want to be soothed, carried, but they will scream and cry. And even if you give little attention, they will scream, they will show temper. So they do not want to be looked at, they will scream, they will show temper, they do not want attention, they do not want to be looked at. All right, now a short point about fever. Fever runs very high at night and is accompanied with great thirst, plus there is white tongue which is always present. So whatever be the disease, whatever be the symptom that the patient comes to you for, if there's this white tongue, you have to think of Antim Crud. Plus sore, cracked and crusty nostril and corners of the mouth, okay, cracked, crusty, sore, okay. You as we go ahead and you also see about the skin related symptoms or the constitution of this patient, you will find that the skin is not very good, okay. Like here also you can see that the skin is sore, cracked, crusty, especially about the corners and nostrils, but even in general the skin is not that good. We'll see when we discuss about the constitution, which is the very next point. So let's study. So now, as we talk about the constitution, Dr. Nash straight away starts by saying that the constitution of this remedy is found in the extremities. So normally when we talk about constitution of any remedy, we tell about maybe the color of the remedy, like the complexion of the remedy, the color of its hairs, or the general build of the remedy. But here Dr. Nash gives a lot of importance to something that is found in the extremities. So what is that? We do not normally talk about the extremities or something when we're talking about constitution, but right now let's see what it is. So there are some points. The first is that the fingernails grow in splits like warts with horny spots, and if by accident one becomes injured or split, it does not repair as it should but grows out of shape. So you would have understood, it's very easy, that the fingernails will always grow in splits. So if the finger gets split, okay, it will continue growing in splits. It won't become like a normal nail, okay. If it does not repair as it should but grows out of shape, it will like grow out of its shape. It will not grow as it should, as it's normally, like as a healthy nail. Like warts with horny spots. So there are warts like horny warts. What is meant by horny means like this kind of shape, okay. So it's a pointed elongated shape that is there. So whenever warts are seen in this kind of shape all over your body, so those are called as horny warts, okay. So in the same way, like warts with horny spots, these nails will grow, okay. And this toenails also like that only. Toenails are brittle, they can break very easily, and they grow out of shape also. So they will also grow out of shape or shrivel up and do not grow at all, or they may shrivel up and they might not grow, and it will remain like that forever. So if you have an injury over your nail and half of your nail maybe gets cut off, then the nail may first of all grow, and if grows, it will be out of shape. And the second thing can be that it does not grow at all. The nail might remain like that only. The half of the nail is there and half is not there. Now here he compares the situation of the nails and etc. with the other remedies. So silica, graphitis and thuja. In silica also the nails are crippled on the fingers and toes. They're crippled, and graphitis nails become thick and crippled. So thickness is there in graphitis nails. Thuja's nails are also brittle, crumbling and distorted. So these three remedies have similar kind of nails. to Antim Crud. Okay, silica, graphitis, and thuja. All right, and all the three are like very good for skin conditions, especially silica and graphitis are very good for skin conditions. Thuja is very good for warts, and also Antim Crud is very good for warts. So there are many similarities. Now he also says that the feet are covered on the soles with corns and callosities, which are very tender. He can hardly walk on them on account of this tenderness. So these corns are very, very tender. So if you have a patient of corns, callosities, who says that he cannot even walk because of these small corns, then you have to think of Antim Crud. So the tenderness is the characteristic here. The tenderness is so much that he cannot even walk. All right. So that's about the constitution, in which we discussed about the extremities, the fingernails, the warts, the nails. Okay, and we also compared it silica, graphitis, and thuja, and we talked about the corns and callosities, which are very, very tender. So now finally we talk about the peculiar modalities, which is the last point in Antim Crud. It is a very small remedy. Like, it is not a small remedy, but Dr. Nash has picked up the very, very important symptoms, and he has talked about them in very short. So he tells us about the peculiar modalities of this remedy. So there's ailments from or aggravation from the heat, okay, heat of the sun especially. So this I've already told you, and it's very general in Antim Crud. It's not only about any GIT related symptoms or anything. It's in general. So there's a lot of aggravation from heat of the sun. And which are the other remedies? Which are the other remedies for aggravation from heat of the sun? It's bryonia, glownoin, gelsemium, natrum carb, and almost all of these will have headaches. Okay, gelsemium can also have diarrhea, natrum can also have diarrhea. So heat will aggravate basically all of these. Okay, remember them: bryonia, glownoin, gelsemium, natrum carb. Okay, radiant heat of fire also aggravate. Not only the heat of the sun, but the heat of fire will also aggravate Antim Crud. This patient feels exhausted during warm weather. Gastric symptoms come on. So see, gastric symptoms will come on when this he gets exposed, or he is under the sun, heat of the summer, okay, or near the radiant heat of the fire. So gastric symptoms usually come on because of this. The ailments from a gastric symptom has to be this, okay. Cough is aggravated coming in warm room from cold air. So see how slight it's like. Even the cough will get aggravated when he comes into the warm room from cold air. So that is the great aggravation he has from heat. Even the warmth of the room will aggravate him. Okay, the second symptom is cold bathing aggravates. Now this is like interesting, because right now we're talking about heat, warmth, which aggravates him, and now we're talking about cold bathing, which aggravates. Normally, what happens is, whenever you feel a lot of heated, okay, very, very heated, you don't like this warm rooms, you will want to go and take a cold shower, right? But here, this patient has cold bathing aggravates also. So which are the other remedies? Rustox and sulfur, and this very this very contradiction you can remember, right? And that will help you recall this symptom. Okay, it's like contradicting. There's heat aggravation and cold bathing aggravates. Now cold bathing aggravates when the child cries when washed or bathed in cold water. Cold bathing causes headache. So we have this cold bathing wala picture. So this cold bathing will aggravate him. It will also cause headache, cold in the head, gastric catarrh, diarrhea, suppressed menses, toothache, etc. So see how important this symptom is. So it can lead to gastric catarrh, it can lead to diarrhea, it can lead to suppressed menses, toothache, headache. My god. So that is how important this symptom is. So there's ailments from heat. There's also cold bathing aggravates. Few scattered symptoms he mentions in the end. He tells us about the bowels. Okay, so we have already learnt about the diarrhea of this remedy, but there can also be hemorrhage from the bowels, meaning there can also be dysentery. The hemorrhage of the blood can be mixed with solid feces. There's chronic redness of eyelids. There's toothache in decayed teeth, which aggravates at night, and there's gastric trouble after acid, sour, wine, vinegar, etc. So right now we have studied that there's gastric issues because of overeating, because of the heat of summer. But here he tells us that the gastric troubles can be after acid, sour, wine, vinegar, etc. Okay, so this was it. So we've all discussed the topics under Antim Crud, and if you remember, let's just like revise what we discussed. In GIT, we discussed the very leading characteristic, which was the thickly coated white tongue of Antim Crud, right? Thick white coated, and the ailments from was due to the overeating. So the patient will overeat, and that will lead to diarrhea or stomach related symptoms, right? Then we've seen that the digestion is very slow, and before the digestion happens only, the patient gets starts getting the irritations, etc., the symptoms. And then we've seen in the mind what was this important symptom. They feel they have this sentimental mood and ecstatic love in the moonlight, right? They feel romantic. And then there is the child is cross, and he does not want to be touched or does not want to be looked at. That will cause temper, so he will show you temper tantrums, he will start to cry and scream. Okay, then we've seen the constitution of this remedy, the very very important constitution of this remedy, in which we've seen that the fingernails will grow in splits. There will be horny, warty like growths, right? The toes will also have this crumbling, brittle nails, right? And the remedies we compared were silica, graphitis, and thuja. We've also seen that the remedy has corn and callosities, and the tenderness is the very characteristic thing about it. Then we've seen about the peculiar modalities, in which we've seen that the heat of the summer will aggravate them, the heat of the sun, the heat of the fire will aggravate them, even warm room will aggravate them. And then we've seen that cold bathing will aggravate them, right? Cold bathing can give them anything from starting from headache, gastric catarrh, diarrhea to suppressed menses, toothache, right? Yeah, so that was it about Antim Crud, and we've completed studying about the digestive remedies of Dr. Nash. We've done all of them right now. So I hope you learned a lot, and I hope that you all go back and learn and read these remedies from Dr. E.B. Nash's Materia Medica. Thank you. Bye bye.